Hi, everyone. I'd like to do a shout out to our sponsor, Bako Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Bako Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of our clients, Bako Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the profession. Bako Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Bako Diagnostics services, get started today by sending an email to corporaterelations@bakodx.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Ritchie. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing fabulous. I'm excited about another round of interviews with students from the Kent State University College of Podiatric Medicine.
Yes, we love student episodes. So thank you so much for being here with us.
Absolutely. At this time, I'd like to introduce both of our guests. They're from the class of 2026 at Kent State. First, Lasya, Priya, Anand. Lasya, welcome to Dean's Chat.
Good evening, Dr. Jensen. Thank you so much for having us over.
Well, you are welcome. And also from the class of 2026, Jamie Stahl. Welcome to Dean's Chat, Jamie.
Hi, Dr. Jensen. Thank you.
You're so welcome.
All right. Well, we would like to have each one of these episodes kind of stand alone for prospective students as they're learning more about podiatric medicine as an opportunity in healthcare. So, Lasya, if you wouldn't mind helping just define for us, what is podiatric medicine?
So podiatric medicine, I know it's not everybody knows, but I think it's the secret gem hidden. But podiatric medicine is a combination of clinical medicine and surgery. So within this specialty, there's so many subspecialties that you're doing. So we are focusing on the ailments and pathology of lower extremity, anything related to lower extremity. That'll be your lower legs, your foot, and ankle. The most interesting thing that I find about it is you're responsible for dermatology, vascular aspect, neurology, musculoskeletal, and biomechanics. And there's so many pathologies related to these conditions that you would so notice that it's just a lot of learning and a lot of interesting pathologies that we end up seeing. So like I said, further, along with podiatric medicine, students can choose to do some fellowships in certain topics such as sports medicine, limb preservation, diabetic foot care, and wound care. That's something that I especially seen so far. I want to focus on further is wound care. With diabetes increasing and a lot of like lymphedema cases that we have been seeing recently, wound care is something I believe with new products and new hyperbaric oxygen therapy, for example, we have really impacted the way we treat the patients and the way the patients are responding to the treatment. So in short, it's a growing small field that I wish and hope that it will grow further. It's a combination of medicine and surgery. So
thank you so much.
Lasya. Yeah, that was excellent. And Jamie, if you wouldn't mind, kind of share with our audience the educational pathway to becoming a podiatrist.
Absolutely. So after high school, you can go through community college or like a 4-year traditional undergraduate, meeting the certain prerequisites that podiatry schools require. After that, you can apply to podiatry school. It is a 4-year program. And then following podiatry school, you apply to a 3-year podiatric residency. And then after that is an optional 1-year fellowship that you can also apply to get further training, specialty training. And after that, you go and find a job.
There you go.
Each step is setting you up for the next thing, right? Well, in that same kind of light, we'd love to kind of get each of your individual stories. So if we can start with Lasya, we'll start with you. If you don't mind giving us where you went to undergrad, And if you didn't get your degree in, or whatever you got your degree in, we'll leave it very open. And then how did you discover podiatric medicine? And if you had the opportunity to shadow, what did that experience look like for you?
I was born in India, but I moved here when I was in high school. So I've been moving around throughout the United States. So did my high school in North Dakota State, then we moved to Texas. So I like to consider Texas as my home. And I went my undergrad there as well. So I'm a undergrad student from UT Dallas. I did major in biology and I minored in psychology. It's really funny the way I found podiatry. Actually, was my best friend from undergrad who was very interested in podiatry. So she's the one who started shadowing podiatrists, and every single day our calls used to be her telling me her experience shadowing a podiatrist. And I always knew I wanted to do something in medicine. So as I was shadowing different specialties, I went ahead and shadowed for podiatry too, based on the experiences my friend shared. I started shadowing Dr. Robjohn. She is a practicing podiatrist back in Texas. I really enjoyed every single day I went, there's something new that they're seeing. That's where I grew my interest in wound care as well, because she works separately in wound care clinic. She goes for surgery clinic in separate hospitals, and she has her own private practice clinic. And I like the variety that I see myself doing in the future, being part of this field. So that truly drew me in podiatry. But actually around the same time, I was having conversation with my father, and back at home, my grandma, she has 25 years history of diabetes. Um, Foot ulcers, diabetic wounds were really bad for her, but there's really isn't podiatry back home in India. If even if there is one for wound, if she has to go all the way 10 hours away, and there's isn't really possible or helpful way for her to get the treatment that she needed. And that kind of really drew me in. Eventually, I do want to introduce podiatry to India, hopefully. And recently, I did see a certain interest from back home. So hopefully, maybe eventually, if we can advocate enough to make that into a recognized degree back home, that's something I'm looking forward to.
Fantastic. Thank you so much for sharing all of that. And I'm excited to watch your career unfold and see how podiatry travels to India.
Thank you.
Jamie, can you tell us a little bit about your experience with undergrad, what you got your degree in, and then how you discovered podiatric medicine and your shadowing experience?
Yes. So when I went to undergrad at Youngstown State University, going initially into the pre-med route, and then when I wasn't too sure about medicine, just learning about the scheduling, wanting to start a family, the long hours and things like that, I went back to my high school guidance counselor, who's a family friend, and he suggested podiatry. And at that point, I didn't realize it was a separate schooling than like medical school. And he explained how the hours were more 9 to 5. It's easier to have a family if you want. So it just seemed a little more kind of what I was like looking for at the time. And then I realized, just from an old sports injury, I went to a podiatrist. I like that, and I like shoes a lot. So a lot of the interests lined up. Um, After undergrad, where I got my bachelor's in chemistry, I did take a year off, a gap year, because I felt like really burnt out. And then I decided I would go back, get my master's at Youngstown State University. And then there I became friends with two of the local residents out from Youngstown, Ohio. And I got a lot of shadowing opportunities during my graduate years. So I was able to go into the clinic with like Dr. DiDomenico and Dr. Plato. Not only in the clinic, I also got to shadow in the OR and see a couple of the surgeries, and also got to attend an Arthrex cadaver lab. So just with all of those different experiences, I just got more excited and intrigued. And, my friends, they tried sending me the gross wound care pictures to see if it would freak me out, but I loved it. It was fun seeing what was going on and learning that aspect of it. So then applied to podiatry school and just felt like Kent with the whole interview process and stuff. It just felt right. And when people tell you just go with what feels right in your gut and it works out, they're not lying. So that's where I ended up going. And to this day, like those two residents I met, they're really great mentors to me. Just finished applying for a clerkship application cycle and had them on the phone asking them their opinions and stuff. Um, and you really start to find out too, podiatry is such a small world and everyone knows each other. So it's been a big help with just having great mentors and friends and those experiences.
Fantastic. Thank you so much. And you're absolutely right. It's incredible how, and the more Dr. Jensen and I talk to people, the more you also realize, like we all say it, like, oh, it's such a small world. And then you really start to know, oh yeah, my best friend is so-and-so. And you're like, wow, I would have never put those two people together. Not for any reason particular than just, it's just so interesting how we all come together. So thank you for that.
That's great. Lasya, I enjoyed your stories about India. You know, some of the tenets that we use in healing diabetic patients came out of Vellore, India with Dr. Brand many, many decades ago. So there certainly is a need there. And I admire your willingness to make a difference there someday. That's fabulous. All right. The next thing I'd like to talk about is the American Podiatric Medical Students Association, otherwise known as APMSA. I'd like to ask how each of you got involved and what your current responsibilities are with APMSA. Maybe we mix it up a little bit. Jamie, why don't you go first on this?
Okay, sounds good. So I got involved with APMSA through my position as the school president of OPMSA. So for my first 2 years, I represent the president's position in the House of Delegation voting. And I would say my role, as far as APMSA is concerned, is I also sit on the president's committee where all of the school presidents and president-elects sit on, and we organize the academic conference that's given in the spring House of Delegation meeting. And that's just been wonderful getting to see make different connections that way and seeing what goes into planning different conferences and bringing in speakers. And then most importantly, just getting to connect with all of the other students from the other schools, especially the school presidents, being able to ask them, you know, how their school runs on different things and just what we could each bring to our own schools to try to just help out the student body as a whole nationally and not just like at our school. It's always a lot of fun to do, a lot of ideas flowing.
Now, are you on any committees representing APMSA with other entities within the profession?
I am not in the president's role.
I understand. Okay, very good. You know, whenever I see all the APMSA reps at the annual meetings, I'm not sure how much work gets done because I think you're all having such a good time. What a networking experience.
Absolutely, 100%.
No, that's great. Thank you for sharing that. Lasya, what's your experience with APMSA? How'd you get involved? And then what are your current responsibilities?
So with APMSA, as you mentioned, Dr. Jensen, it's American Podiatric Medical Students Association. So we represent all the 11 podiatric medical colleges and the students. So for each school and for each class, you have an individual elected as an APMSA delegate. And on top of that, you also have alternate delegates, which is when sometimes you see two delegates for that class representing sometimes. And along with APMSA delegates, like Jamie mentioned, she's the president for OPMSA. So we both as a delegate and as a president attend the annual HOD, which is the House of Delegates meeting. That's where most of our discussions as students from different schools happen. So we take a lot of initiations. We have a lot of discussions on what's happening, what's relevant, things are going on, occurring in the field. And we have representatives from ACFAS, from ACPM. So if you have any questions regarding boards, anything regarding clerkships, and any suggestions we as a students think we think are important, we make at that meeting. And I must say, like, there are a lot of times when representatives come, they hear us, they listen to us, and they do implement the necessary changes. So that's have been a really positive impact and even satisfaction for me being in this role. So main responsibility, like I said, would be to attend these meetings. Along with that, I'm responsible for conveying all the information and informing anything and everything that's happening at the meeting to my fellow classmates. That's been I've been considered the bridge between the APMSA as the whole organization and my class of 2026. So we, like you mentioned, the committee. So I am part of the education committee. So for APMSA, you have education committee, legislative committee, PR committee, and communications committee. I can talk about being part of education committee. We do a lot of panels, whether it's about boards, clerkships, practice management, and certain times we initiated journal clubs as well to initiate collaboration of students from different schools. So, and on top of the committees, we also have liaison positions. So I am liaison to the American Public Health Association. Since I'm interested in public health, I went towards that side. And I know Sierra, a fourth-year delegate for us, she's part of APMA PAC. Eric, fourth year again, is part of AACPM. So depending on your interest, which organization you want to have a connection with, there's always opportunity being part of a delegate to do that. So.
Thank you very much. It always amazes me how active our students are in these APMSA and other clubs, because the curriculum by itself is difficult, but then adding all these other responsibilities, my hat's off to you, because somebody has to do the work, right? So thank you.
And to your point, Jeff, how many individual facets and opportunities there are for students to get involved. Because I agree, like I'm trying to remember back, and I know it's always fun to try to think backwards and be like, how many people did we have in the APMSA? And I know we definitely had one, but I think there were more than one, maybe two. So again, it's remarkable how much growth the profession has seen. And it's because students are interested and students are helping move things forward with advancing kind of how we make things better, and fresh insights, fresh opinions, interests that people have. This is really what helps fuel next generation. So we commend both of you and all of your colleagues that you work with. And it's a nice segue too from Jeff's statement, or Dr. Jensen's statement, which is really, I mean, medical school is not a backseat really to anything, and you are having to struggle multiple things that are competing for your time, energy, and attention. So if we could maybe talk a little bit about the curriculum at Kent State, so that students that are interested in what Kent State looks like and what it might have to offer. Lasya, you offered to do the first and second year for us. So could you talk a little bit about what the curriculum looks like in terms of kind of classes they would expect to see? We'll start with first year and then you could transition into second. And can you talk a little bit about interdisciplinary options as well, as Ohio has now become part of Kent State University?
Before I even start talking about the classes, I did also have a gap year. So transitioning from just working, not having classes, and coming into medical school, it was a difficult task. And I think studying or managing your time in undergrad is extremely different than how we have to do in medical school. But like you said, with all the extra commitments we have and with the skills you must learn, keep learning, even if you learned or you think you mastered, but that's what like Dr. Jensen was saying with the time commitment issues. It is a lot about your time management skills, I believe. And personally, any suggestion I would give is, if you understand or know the learning style you have, whether it's visual or auditory or any style that you like, I think it will truly help that person study that material better, also remember it better. So that's something I wanted to share that with our fellow students. So regards to the curriculum, so first 2 years of the podiatric medical school at Kent State are all core classes. You must take basic science classes that will prepare you for boards or prepare you to learn about the human body and different subjects related to it. So for first year, you're taking very basic, which you might have taken some of those classes back in undergrad. So that includes your biochemistry and cells and tissue. So they call it cells and tissue and staying alive class, which basically stems under histology and biochemistry. Along with that, we take human anatomy, and I think that's one of the biggest course that you are taking as a first year, and majority of the time goes to that course. So first semester, you're learning just the general anatomy, upper anatomy. So we're not really touching the lower extremity yet. So all the information related to that is where you're focusing on for that beginning semester. Along with that, we have embryology and medical genetics class that just kind of embryology would be part of your human anatomy, but they just made it into a different course for you to separately learn and not mix up the information. Um, and we have some classes called medical ethics, and we also have principles of medical research class. And if that's something you're interested in research, so after taking the class, you can reach out to professors and the course coordinator, and even the Kent main campus, that if you're interested in research. And I believe there's just one class, they call it the Podiatric Professionalism Society. So that just for us to learn the basic professionalism that I think we all need to know as being part of the medical field. That's all your first semester. And then your second semester, you move on into lower anatomy, and you take microbiology and same courses like this, which continue on to your second semester. Then we go to and we have summer semester actually. So I know not all schools have summer semester, but we do. So those are basic, just you're taking around 6 credit hours. So that will be your biomechanics, rehab, and radiology, as well as lower extremity assessment and diagnosis. In that class, you actually learn the practical skills, like how are you going to take the neurology testing? How are you going to do the vascular testing? So they introduce you around between first and second year, the basic skills that you need to know. Moving on to second year, again, these are our core classes that I think you need majorly for preparation for your boards. That includes your pathology and your pharmacology courses. Along with that, they start introducing specific podiatry related and podiatric medicine related classes, where we learn about osteoarthritis, about gout, and different pathologies that we see in podiatry. Recently, they made a change where they're combining biomechanics, radiology, and the podiatric medicine aspect, and they're combining into one class. So they're discussing to you about a topic on osteoarthritis. At the same time, they'll discuss any issues related to biomechanics, any radiology related issues together. And I think that is a good way that new reform that they have made. I think that will help the students. That way you remember the things better. But that's all the classes for second year.
Thank you so much. All right, Jamie, can you tell us a little bit about, I know you're in your third year now, so can you talk a little bit about third year, what that looks like? Are there classes in the third year? And then what your fourth year will look like next year?
Yes, so in our third year, it is a mix between being in the clinic and a couple of classroom courses. So currently third years right now, one of the bigger courses is medicine, which they're actually moving to second years because based on previous years' feedback, it is very beneficial for boards part one with that material. So they are currently working it into our second year's curriculum. And that's one thing I will give Kent administration is they are phenomenal at listening to student feedback and adjusting curriculum, courses, and things like that to make it more beneficial to students. So beyond that, one of our main courses is surgery right now. And then we have a few smaller classes such as behavioral medicine, which is kind of like the a little psychology side, and how that relates to podiatric medicine. We touch on neurology, dermatology, and we have a women's health course. I think that's all of them. But those are like just slightly smaller. So like I said, the heavy hitter is surgery. And then in the springtime, we have surgery again, and then also traumatology. We have the lecture portion of that. And then throughout third year, like I said, we're in our clinic rotations. So we rotate through different ones, such as we have radiology, really learning how to read the x-rays, and also operating the x-ray machine. We have 2 clinic locations. We have one at our school and then one at a downtown location. We also have a VA rotation where we go to the Cleveland VA and we work out of their clinic. We have 2 months on surgery. So we're with different surgeons throughout the Cleveland, Akron area. 2 months watching surgeries, a month on wound care, and we also have a simulated patient 1 and simulated patient 2. So that's where we're going in with patient actors, getting different scenarios like that, preparing us for how they used to have the OSCE exam and stuff. So Kent kind of has their own form of that exam right now that they're doing for us, so that we are proficient in the clinic in that aspect. And then, and also a surgical skills lab, doing different like bone saw procedures and hand ties and suturing and learning those fine skills. So that is 3rd year. And then going into 4th year, you are on your externships, going to different residencies. And that begins in, I believe, for our school in May. And we can visit up to 7 different externships. We have an optional month where we can do an externship or like a private practice. So I know like for myself, I'm opting to do a private practice rotation to learn that aspect of the medicine. 2 months are senior medicine rotation. So we can either contract it with our own medicine doctor, or we have some contracted through the school, whether it's like the local like vascular surgeons in the area, trauma, the burn unit, different areas like that we spend 2 months kind of learning like the full body as well. Yeah, and then like I said, 7 months on the externships, and then we do have a month where we rotate out of our 4th year, our VA, Independence and Midtown clinics. So we spend a month there as well. And it's great, the attendings during 4th year, because they'll all help us with preparing for board questions or interview questions, to also prepare us for those other exams coming up.
Fantastic. At the same time, I was going to ask you about boards prep, but it sounds like they give you dedicated time and preparation courses.
Yes, they actually give us for boards part 1 at Kent. We have anywhere from, I believe it's like 8 to 9 weeks off our 2nd year summer that we can all kind of go home, go wherever, and we study on our own. So I know for me, I enjoyed that as a student because I could hit topics where I felt like I was weak on, and kind of breeze through topics that I felt stronger on and study at my own pace. Study the way I like to do a lot of practice questions. I can't just read something and have it stick. So having that nice like autonomy was really nice. I think as Lasya was saying, with knowing your study habits, and also just having a good like support group and friend group to check in, I think is always super important, because when you struggle on something, I know I can text one of my friends and they can explain it for me. And that makes a world of difference with trying to balance everything academically and then holding different positions and responsibilities at the school.
Very good. So my favorite part of interviewing the students is giving you an opportunity to shout out some of the professors that have had an impact on you in your education. Lasya, why don't you go first? And since we have 2 of you on, you feel free. You can name 2, 3, 4 different professors that have are deserving of a shout out.
I will like to shout out to Dr. Kavalak. I'm a curriculum representative and she's the head of the committee. She is the most patient person I've seen. Have gone through to her with student complaints, asking her, oh, this schedule doesn't work this way, but she always listened to me, made sure, even if it is a silly thing that she might think, she still put it in the agenda, had a discussion over it. I always felt we as students were heard through her. And for that patience, I will definitely love to give shout out to Dr. Kavalak. Along with that, I'll give it to Dr. Johnson and Dr. Blazer. These were our appointment skills professors. They really taught us all the skills that we really are currently using in the clinic, whether doing injections on each other, telling us 2 different ways, because each professor has a different way of teaching. It was just really fun in the class. I always felt I am learning, even if I need extra help. I never felt judged for learning a skill again and again. And for that, I'm really glad to have them. So
Thank you. And Jamie, your professor shout outs.
I have to say, our associate dean, Dr. Caldwell, whenever he comes in and does a guest lecture, those are all amazing. I really like how he understands how there's different styles of learning, and he will take time out of his day to help you with whatever you need. Um, and then also, I'd say like our MD instructors, Dr. Peerless, Dr. Mooney, Dr. Robinson, they are so smart and intelligent, but the nicest people. They don't make you feel dumb for not knowing something. They really take the time to teach you how to learn it. And they put so much effort into their lectures and teaching, and you can just tell the time and the passion that they have for it. Oh, we don't deserve them.
That's fantastic. And Joe, I think it's time to do a little shout out to our sponsor, Bako Diagnostics.
Absolutely. We love shout outs. So take it
We
away,
all-
Jeff.
We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet. We love to do shout outs to, Joe's got the Bako.
Right? It may have to become my flat Stanley. I don't want to like hijack the episode, but my daughter is obsessed with these, and that we started something on social media. So I might have to take it around and take pictures with it. So
There you go.
yay to Bako.
I don't know if you've all had an opportunity to do a dermatology Bako Diagnostics lab. Have you done that? Oh, that's fantastic. Yeah, they do it at all the colleges. They've given back so much to our profession. We're very appreciative of that for sure. Now, the big question, why Kent State? Why did each of you decide to pursue your podiatric medical education at Kent State? Lasya, why don't you go first?
There are really a lot of reasons for me to choose Kent State. One of the biggest was when I was applying for all the applications, and I wasn't really sure since I just got out of my undergrad and I was trying to figure out. And I was even trying to see if I even want to do podiatry. I just reached out to Kent State, and they had a student ambassador connected to me right away. They didn't even know if I was going to do podiatry or not, yet they took the time and effort to coach me, tell me, read my personal statement, gave me comments, and I felt really. I felt I could see myself being there for 4 years, where there's such a supportive environment. Along with that, when I did my interview, it felt like a conversation, just like we're having right now. It just felt like a conversation. It was just questions about me, it was about what I did, like volunteering work, or what I did as a medical scribe. It really made me feel I will be heard there. I'll be seen. And they also showed me all different tutoring opportunities they had. And as a student, I always believe you should never hesitate to ask for help. If you need help, ask for it, take it. It really doesn't matter if you are starting a level below someone, eventually you all reach the same place. So for all the opportunities they gave me, I could truly see myself being there. So I chose Kent.
We all need
Fantastic.
help. Everyone always needs help. Really, like everyone needs help at some point in their life, in their career. And the best thing to do is ask early and often.
Right.
Yep.
Amen.
Sorry, Jeff. Back to you.
No, that's all right. Jamie, why did you choose Kent State for your podiatric medical education?
Going into interviews, one of my top reasons for Kent being an option was it was close to home for me. So with my dad's health conditions, that was a nice peace of mind. Now being in school, it's nice to just go home on the weekends to get away from school. But the main reason was my interview. It wasn't an interview. It was a conversation, like Lasya said, and the atmosphere of the school just felt very friendly and very supportive. And that's what I was mainly looking for in undergrad. I had a hard time of asking for help when I needed it, like early enough. And Kent State just seemed very welcoming, open door policy. The instructors were so just outgoing and nice and friendly, supportive. So, and that's just what I kept getting from the students. And when I was done with my interview, I was so excited about it and just felt completely different than any other interviews that I went through. So at that point, I just knew like Kent is where I want to go.
Oh, that's fabulous. Joe, as we do these interviews with students, I'm constantly reminded that our profession's in great hands going forward.
Absolutely. And Jamie, I think you had commented earlier today about you tell other students like when you feel that like that gut response. And I fully agree with that. There are so many opportunities out there that being able to acknowledge what you need and the space in which it's going to give you what you're looking for in the way that you're looking for it. Nobody can answer for that except you. And there's lots of different ways to achieve goals. And so I'm gonna detract just a teeny bit, only because I forgot to ask them one of the questions. As we've interviewed lots of different students, some of the things that help people determine, I really liked that about this school. I like this over that other, there's all these different options. Can you talk about class size? Because that was something some students went to a smaller undergrad and they like a smaller class size. Others like the opportunity to be interdisciplinary and immersed in other programs. What does it look like at Kent State for class size, and do you take courses with any other programs on campus?
So,
So we, oh,
Jamie.
Sorry, I didn't call on anybody. I made that confusing. Go ahead. We'll start with Jamie since it was your inspiration, and then Lasya will jump back to you.
So with Ken, we are actually out of Independence, Ohio, and our building is just podiatry. So we are only with podiatry until I think when you're doing like that senior medicine rotation in your 4th year, then you're with some MDDO residents. But what I like about that just being podiatry is you can go to anyone in the school, and if you have a question, they have an answer for you. Or worst case scenario, you go to our school librarian, Donna, shout out Donna. She'll get you the answer. She knows everything. But it's really nice because for me, when you're in the anatomy lab, it's just podiatry students on the body. So, I mean, we have a lot of freedom where if the school's open from 6 a.m. to midnight, we can go in the lab. We don't have to be supervised. So that was a big thing with learning anatomy, because what's better to learn off of than the actual cadaver itself? So having that opportunity, and that we only have 3 to 4 students on a cadaver as well, you are getting that opportunity to learn that way. The amount of tutoring that Kent State offers, I think, is huge. There's multiple sessions throughout the week for all of the courses, and they've even implemented it through 2nd and 3rd years, where we have the class above us will write us practice questions to help with those courses. And typically, I think a full class size is about like a little bit over 100. Currently, they have been smaller with everywhere. So right now we're in like the 50 to 60 ranges. But what's nice is the instructors know everyone, because again, it is just podiatry. So it doesn't matter the class sizes. They're going to know who you are. And we actually offer kind of like a dual learning system where you can go to class and attend in person, which we do have a handful of students that do it that way. But we also offer a program called Boxcast. So it records it. So you can watch it a live recording, or you can go watch it later, or just go back and rewatch the course on Boxcast. So if it's easier for me, some of the courses I need to like pause and go look something up because I don't know what they're talking about, or I just need another way to learn it. So that's what's really nice about at Kent, is they're very adaptable to the different styles of learning, and I think working with you as well.
Thank you. Anything additional you wanted to add, Lasya?
I was just going to say, I mean, the undergrad where I was used to taking 300 students in a class. So maybe it is the familiarity that I was okay seeing 120 class size because I was used to it. But what I like the most about the campus is I walk in and everybody's familiar there, because it's just us podiatry students on the campus. So I think I know the 2nd years, I know the 1st years, and especially when I was a 1st year, any person I can just stop by and say, oh, I'm stressed about this concept. Oh, I don't know about this. And anyone is willing to help you, provide you all the resources. So it truly feels it's your campus, like it's your place. And I think that's what I really love about just having us podiatry students in the campus.
Thank you so much.
So what do you do to relax, to kind of between exams or to recharge your battery? Lasya, would you like to go first?
Course. We actually do a lot of class things too. So every semester, we all go for laser tag. So bunch of almost 30, 40 students. I mean, we are around 60. So 30, 40 students, we all show up at this place like laser tag, and then we all just like it's just interesting because some students who I have not talked before, I talked in these activities because you're forced to see even more people than the circle you usually hang out with. And I think as a class, it does feel, oh, as a class, we stand together with these activities. And we have a lot of club activities. For OPMSA, we do Flashapalooza, which is basically a carnival. This is mostly for the upcoming first year students. So we introduce all the clubs, activities, we have food. I think this year we had Kona Ice because it usually happens at the beginning of the year. It just it just feels okay. Campus is not just about studying, even if it is med school. We are here together to celebrate us being medical students. So, and this is all the class things we do. I have my core of friends, and we love going. I love ice cream, so surprisingly, Ohio has a lot of different ice cream places. So, it's just something for anybody. Like we have Rock Hall of Fame, we have a lot of sporting events. So, I love exploring food too. So after exam every that day we all just go for bowling and go get some good food. So I personally do believe you need to recharge yourself after studying that heavily, and without that rest you'll feel burnout. So
Well said. Jamie, what do you do to recharge the battery?
I do a lot of the things that Lasya said with participating in those outside like club activities, like the club carnival, and then also like the or flag football tournament, things like that. And then just kind of for myself, I like to go back home and just do some like artwork, painting and crafting and stuff, working with my hands and not doing academics. And then also just going and playing with my puppies. Oh, yes. They always bring a smile to my face.
There you go. Joe, anything else you'd like to discuss?
No, that was perfect. They kind of segued for us into class activities, and that was so. Thank you so much.
Yes, Jamie and Lasya, thank you so much for joining us on Dean's Chat to discuss the Kent State University College of Podiatric Medicine. Joe and I are going to send you each a Dean's Chat cup, and you'll need it, right? You're going to have a lot of late nights, early mornings, put a little caffeinated beverage in there, and you're in business. To all, thank you again. And to all of our listeners out there, if you're on Apple Podcasts or Spotify, please give us a 5-star rating or even leave a couple comments. And if you're on YouTube, please become a subscriber. And we'll see you all next week on Dean's Chat. Cheers.
Cheers.